Hey everyone, thanks for making it to the end of the post. Bone stress injuries part 2. Part 1 I addressed a little bit more about what a bone stress injury is and why we categorize it as an overuse injury. And in this part 2, I alluded to different types of bone stress injuries and stress fractures, high risk versus low risk, but also how they'll typically start to present. And like I mentioned in the post, it's going to be some diffuse pain, very non-specific. That's what I mean by diffuse pain, kind of a gradual soreness, a gradual onset, which usually worsens with activity and then will subside shortly after the activity. That's kind of the initial stages of bone stress injury where the bone cortex is starting to break down and we're starting to experience that, I guess the effects of that repetitive stress, and your body's kind of letting you know it's not ready for it. And then as we move on to kind of more severe, you're going to notice them, maybe if you're on your feet for the whole day, towards the end of the day, that area will start to bark at you a little bit more, even though you didn't do any activities. So it'll start to mimic the pain that you're experiencing during some sort of higher level activity. So basically what it's telling you is it's not okay for you to be on your feet the whole time or the whole day. Also, common sites of bone stress fractures are we call the metatarsals the long bones of the foot. So kind of the larger middle part of your foot. Those are the metatarsals. So the second and third metatarsals are really common injury sites for stress fractures. The outside part of your foot as well. There's a small piece of the bone out there that breaks down. The outside part of your shin bone. Your shin is made up of two bones, the tibia and the fibula, and the fibula is a common site to break down, as well as the femur. So the long thigh bone, one of the strongest bones in the body. Also the calcaneus, your heel bone, is also one of the strongest bones in your body, but that's a common site of breakdown too. And what's the common theme is that they're all in the lower extremity. They're all in the lower body, and that's because when we're doing a lot of high level activity, we like to hit the larger muscle groups, and tends to be how we get the most bang for your buck with exercising. So larger muscle groups, lower body, those are going to be the areas that break down first. So. But again, don't worry. If you do experience some of those symptoms, double check. Okay, am I eating a lot? Maybe take a little break from the activity, see if the pain subsides. Sleeping, are you recovering well enough? And if it's really something that's still bothering you, because a lot of times they can mimic other innocuous musculoskeletal issues, then don't hesitate to get in touch with a healthcare practitioner. You don't need an image right away. We can definitely narrow down the focus and get a differential diagnosis of an injury with a good clinical examination. So keep that in mind also. And then usually if we suspect some sort of bone stress injury or other structural issue, we'll refer out for imaging, but doesn't necessarily need to be the first go-to. So early management is key with any injury, especially with the bones, so we can start that healing process right away. And then also the next blog post will get into some of those high risk versus low risk bone stress injury sites or stress fracture injury sites, which will really make a big difference in terms of how we're going to proceed as far as can we be a little bit more, aggressive in treating and addressing the issues. So thanks for reading the post. Hopefully it's clearing some things up for you guys. And again, part 3 will address more of these high risk, low risk areas and some of the things that we can do to start treating them. So I'm staying warm in front of the fireplace. It's really frigid today. Hope you guys are having a great day. Bye.